your life. Chapter 9. Recovering your health. Your stroke may have been caused by a variety of health problems, but it puts you at risk for even more. If your mobility is impaired, it will be more difficult to exercise. If your income is reduced, it may be harder to eat right or get the medical care you need. It's important now more than ever to make sure you're doing everything you can to optimize your health, both to improve your recovery and to prevent further complications. We asked the experts about the optimal nutrition, exercise, and rest for stroke survivors' overall health. Question 61. What should stroke survivors do to improve their health after a stroke? Dr. Hinkle. The things that are important for all of us, such as diet, exercise, and good sleep, become even more important for a great recovery after a stroke. Actually, this applies both to the stroke survivor and the caregiver. Both should try to be in optimal health in order to get back to as many of their normal activities as possible. Try to eat 3 nutritious meals a day, sleep 8 hours every night, and get some exercise. Dr. Plomin. We know that someone who has had a stroke is at high risk of having another one, so you want to do everything possible to improve your lifestyle in order to reduce your stroke risk. You can improve your diet by reducing saturated fat, eating lots of fruits and vegetables, and reducing salt. Definitely increase your physical activity. Try to hit a target of at least 30 minutes of moderate exercise 3 times a week, at an intensity where you feel tired. And absolutely stop smoking as soon as you can.
Have a good relationship with your doctor and allow time to discuss issues. If you need help, bring a caregiver. Practice what you want to say beforehand or write your thoughts down. Ask the doctor to write down key words so you can go home and research more. Become your own advocate. David.
A tip. A stroke survivor's loved one often takes on the advocate role immediately after a stroke. As a stroke survivor regains function, it's important for loved ones to hand as much responsibility as possible back to the survivor. This helps a family move from a state of enabling the survivor to being in a passive recovery role to empowering the survivor to take charge of his or her own recovery. The sense of power and mastery is something we all need in our lives. It is also a powerful antidote to prevent depression. Question 62. What is the best diet for a stroke survivor in recovery? Dr. Roth. When patients first come to me in inpatient rehab, I tell them that one of the 2 most important things to remember is nutrition. The other is sleep. We emphasize the need for protein intake. Stroke survivors are using up a lot of energy, and they're trying to build up muscle. For immediate energy, they need some kind of carbohydrates. But basically, after any kind of brain injury, there's a sizable amount of protein loss, so we urge people to eat protein. There's good research on how protein levels improve outcomes after stroke, so it's quite important. Typically, we recommend 1 gram of protein per kilogram, or 2.2 pounds, of weight per day. For people who have other medical problems, which many people do following stroke, will go up 1.2 or 1.5 grams per kilogram. I prefer to have people get their protein by eating high-protein foods rather than by using supplements or powders. I tell them to eat lean meat, fish, turkey, peanut butter, or eggs. Many stroke survivors have problems with constipation or bowel function, so I always recommend fruits and vegetables for the fiber and other nutrients too. The problem is that a lot of people are eating junk food, which may be what led them to have a stroke in the first place, so trying to change those habits into better food choices is a big challenge. Dr. Chu, diet is so important. Patients think, oh well, here's my doctor once again telling me how important it is to eat right and to exercise. But these are critical. We talk about stroke being preventable, but that doesn't mean it's going to be easy. We know the tools. Every physician tells every patient to eat right, no matter what the condition is. It goes double for preventing another stroke. Reducing sodium is essential. You have to cut your salt intake from processed and prepared food. Reducing carbs and eating a Mediterranean diet is also highly recommended. It can help with the control of diabetes and metabolic syndrome, high blood pressure, blood sugar, cholesterol, and body weight. The Mediterranean diet has data supporting that it can improve heart health and reduce the risk of vascular disease, including stroke. For people who aren't familiar with it, the Mediterranean diet is a diet high in fresh fruits, vegetables, fish, whole grains, and olive oil. The modified Mediterranean diet. Many of the principles in my book, The Brain Fog Fix, are especially important for stroke survivors. Remember, stroke is the second leading cause of dementia, so all the strategies that have been linked to dementia prevention are vital if you've had a stroke. For overall brain health, I recommend a modified Mediterranean diet. It's modified because it is very low in processed carbohydrates, including flour and sugar. It is high in beans, vegetables, whole fruits, omega-3 superfoods like wild salmon, and healthy fats like olive oil. And it's low in the saturated fats you find in American pepperoni pizza and cheese. Most Americans think of pasta and pizza when they think of Italy, but the pepperoni pizza and spaghetti and meatballs Americans eat have no place in this type of diet. Spiking your blood sugar with too many processed carbohydrates and too much soda, bread, pasta, flour, sugar, and high fructose corn syrup can interfere with the brain's ability to rewire. Factory-farmed animal products have high levels of omega-6s that lead to inflammation in the body and brain. You need some carbohydrates, but most people around the world eat far too many processed carbohydrates. And research shows a low-carbohydrate diet may protect the brain. A clinical trial is now underway to examine the effect of a low-carbohydrate diet on post-stroke recovery in survivors. In addition to this clinical trial, a number of recent studies have shed light on how a modified Mediterranean diet may help stroke survivors. In 2015, UCLA research demonstrated that high-sugar diets, specifically diets that contained large amounts of processed fructose in the form of high fructose corn syrup, interfered with the brain's ability to heal from traumatic injury. While a stroke is not a traumatic brain injury, it is similar in that both conditions require the brain to grow new cells and rewire for optimal recovery. The research team found the sweetener interfered with the ability of neurons to communicate with each other, rewire connections after injury, record memories, and produce enough energy to fuel basic functions. It prevented neuroplasticity, the birth of new brain cells, that is critical to a stroke survivor's brain rewiring. Another study, which was published in the New England Journal of Medicine, found that 30% of strokes, heart attacks, and deaths from heart disease can be prevented by following a Mediterranean diet. The dietary changes in the study included extra virgin olive oil and/or nuts daily, fish 3 or more times a week, beans 3 or more times a week, white meat instead of red meat, at least 3 daily servings of fruits, and 2 daily servings of vegetables. A study published in Frontiers in Nutrition found subjects following a Mediterranean diet showed improvements in language, attention, and memory. And a groundbreaking 2016 study found that people who followed a Mediterranean diet had larger brains. The frontal, parietal, and occipital lobes were actually thicker. Of the foods in the Mediterranean diet, fish and beans were found to be especially associated with thicker brain structures. In this same study, the subjects who consumed large amounts of carbohydrates and sugar had smaller brains, as those same lobes were thinner. For stroke survivors, retaining remaining brain cells and growing new ones through neuroplasticity is vital. Vegetables and whole fruits are a vital part of a modified Mediterranean diet as well. Eating at least 5 servings daily has been shown to reduce stroke risk significantly. In the brain fog fix, I recommend a whopping 7 servings of vegetables and whole fruits a day, as this is how many servings the healthiest and happiest people around the world reported eating. Cruciferous vegetables like broccoli, kale, cauliflower, and Brussels sprouts may be especially helpful in reducing stroke risk, but you should also talk to your doctor if you are taking the blood thinner Coumadin, since vitamin K in these vegetables can interfere with this medication. Talk to your doctor to see if there are any dietary restrictions with any of the medications you are taking. You've probably heard of omega-3s, which are found in seafood like wild salmon. Of the 3 types of omega-3s, DHA is probably the most beneficial to stroke survivors. DHA helps to maintain healthy cognition, prevents dementia, and acts as a building block for the brain. Pregnant mothers need DHA to support their infant's brain development, and stroke survivors need DHA to promote neurogenesis and the rewiring of their brain. The best source of DHA is seafood. Here is a list of seafood-based omega-3 superfoods that are high in DHA omega-3 and also low in toxins like mercury. Albacore tuna that is labeled troll or pole caught. Farmed Arctic char, farmed barramundi, farmed coho salmon, wild Dungeness crab, wild long-finned squid, farmed mussels, farmed oysters, wild sardines, shrimp, farmed rainbow trout, wild salmon, and wild prawns. According to the most recent research, eating a serving of one of these at least 3 times a week can support brain health and recovery. One of the cheapest and easiest ways to do this is to find wild salmon in vacuum-sealed packs next to the tuna in the grocery store. Farmed rainbow trout is another favorite of mine, as it's mild and inexpensive. While they won't provide as much DHA as seafood, plant-based sources such as walnuts, chia seeds, and flaxseed can provide vegetarians with some DHA. Here's a summary of the simple changes you can make in your diet to help heal your broken brain. The best protein foods for brain health are seafood and beans. Eat them regularly. When eating seafood, favor the varieties in the list above. These are high in DHA omega-3s and low in toxins like mercury. Eat less meat in general. When you do eat meat, favor grilled chicken over red meat. When you eat animal products, favor organic, grass-fed, or pastured varieties over conventional varieties. This is true for dairy products and eggs as well. These types of animal products have more anti-inflammatory omega-3s and fewer pro-inflammatory omega-6s compared to conventional varieties of meat, dairy, and eggs. Olive oil is the best oil to use for overall brain health. Use extra virgin olive oil for dressings and salads. Extra virgin is not stable at high temperatures, however, so use light or plain olive oil for cooking. Reduce or eliminate industrial vegetable oils, such as corn oil and soybean oil, that are found in most processed foods. Eat more nuts. Favor any kind of nut over peanuts, since peanuts are not a true tree nut like walnuts, almonds, cashews, and pistachios. Look for plain nuts rather than nuts cooked in oil, as the oils tend to be high in pro-inflammatory omega-6s. Reduce or eliminate flour, sugar, and artificial sweeteners. If you need a sweetener, choose stevia. Favor healthy grains like quinoa, barley, sprouted grains, and brown rice. Get carbohydrates from whole fruits and beans. Reduce your carbohydrate intake by substituting cauliflower or broccoli for pasta. Make cauliflower rice or buy frozen varieties. Use a vegetable peeler to make zucchini noodles, or use spaghetti squash in lieu of noodles. When you eat a sandwich, order it wrapped in lettuce instead of bread. Eat just one of the pieces of bread, or if you're somewhere that serves sandwiches on big rolls, ask for your bread to be shelled out, which is the inner bread pulled away and discarded, which reduces the amount of flour you'll consume. If you're eating pizza, favor thin crust over thicker crust to reduce the carbohydrate content. Aim for 5 to 7 whole fruits and vegetables a day. Again, check with your doctor for any interactions with prescription medication, especially if you're taking Coumadin, since vitamin K can interfere with this drug. Question 63. Are there any vitamins or supplements stroke survivors should take? Dr. Chu. There's not a lot of evidence suggesting that stroke survivors should be taking specific vitamins or supplements, but a general one-a-day multivitamin that contains B vitamins, including folic acid, may very well be beneficial. There is now a fairly strong and established link between folic acid deficiency and an increased risk of stroke. I don't recommend any of the other supplements marketed for brain health. We don't always know what is contained in those supplements, and it's very hard for medical professionals to recommend things when we don't know what's in them or what complications they might create. Dr. Carmichael, most of the natural supplements have never really been tested, so there's no clinical evidence to support them. They fall into this big alternative medicine bin. Patients pay out of pocket, and the supplements can be quite expensive. I don't routinely recommend them, especially if they're pushed by an herbal medicine company that deliberately tries to keep them out of the medical realm. Herbal medicines are not regulated by the FDA or the Food and Drug Administration, so they don't have to be tested for the claims made by the manufacturers, which can make them quite profitable for those companies. I usually don't recommend any of those to my patients since they're not tested. If you're considering taking supplements, talk to your doctor before you do. Some are known to be harmful. There are bad mixtures of herbal and alternative medicines that can have effects on the liver or other dangerous side effects, so these supplements should be avoided. As for the other ones, I simply tell my patients that there's no evidence that they work and that they can be expensive, so don't put yourself at financial risk by pursuing them.
One of my concerns is bogus claims. Sometimes companies claim quick fixes, but I haven't seen any. I'm wary of products and programs that sell false hope. Stroke survivors are a vulnerable population. We want a quick fix, we need hope. I advise people to be very cautious. There are medications, foods, and therapists that help recovery. There is probably no miracle cure. You and your hard work will become the greatest miracle. David.
A tip. No matter the problem, people tend to use polarized, black or white thinking when it comes to healing. One therapy didn't work immediately, so they abandon it completely. The next week, they're on to some other treatment that is going to be the cure-all. In most cases, it's more gray area and less black or white. For most survivors, a combination of different strategies, therapies, medications, and lifestyle choices will collectively optimize their personal recovery journey. Question 64. Is it safe to drink caffeine or alcohol after having a stroke? Dr. Chu. Moderate caffeine intake has not been shown to be a risk factor for stroke. So for those patients who've had a stroke and want to have a cup or two of coffee or tea, it's not a problem. Assuming that there are no other medical issues that would impact the safety of drinking alcohol, moderate alcohol intake is not a stroke risk factor either. Moderate means a maximum of 1 or 2 drinks a day. On the other hand, excessive alcohol consumption does increase the risk of stroke. Talk to your doctor first to make sure alcohol consumption is safe for you with the medications you're taking.
A stroke survivor says, I have difficulty swallowing. Why is this, and what can I do about it?
Dr. Hinckley. Difficulty swallowing is known as dysphagia, and it's very common immediately after a stroke. Some swallowing problems have to do with problems in the mouth, and some have to do with problems in the throat or farther down. Because there are different types and causes of dysphagia, there are different ways to manage them. The best thing is to be properly evaluated by a speech-language pathologist. You may get suggestions about the type and texture of food that is safest or easiest to swallow. Sometimes there are certain positions or exercises that can help. All of these recommendations are specific to the nature of the problem, so the first step is to get evaluated. It's very important to make sure you are swallowing safely to prevent getting pneumonia and to keep nourished and hydrated. Question 65. How much exercise should a stroke survivor get? Dr. Plomin. It depends on the type of exercise. If we're talking about task-specific training, things like reaching tasks or placing your leg in the right position to walk again, you'll probably need to do thousands of repetitions of those tasks in order for the brain to rewire and for you to regain the ability to do those tasks again. In terms of strengthening and aerobic fitness, we know you need to do that 2 or 3 times a week at moderate intensity to see any real functional gain. How much is enough depends on the type of exercise and what you want to improve. Question 66. Is it safe for stroke survivors to go back to the gym after a stroke, or do they need special exercise equipment or supervision? Dr. Plomin. Going back to the gym is a good idea and a smart thing to do. Check with your family doctor first, though, because your stroke may have been related to a problem with your heart, high blood pressure, or something that can cause problems with exercise. Also, when you use heavy weights, you tend to hold your breath, and that can increase your blood pressure. So you need to know from your family doctor if your blood pressure or AFib is being controlled well enough for you to exercise. If you don't have any problems with your heart or high blood pressure, you can probably go to the gym. The challenge is that in the real world, gyms are made for people who don't have any disability. Getting on and off the machines may not be easy for you. It's good practice to get the help of a physical therapist for your first few visits. If you don't have a physical therapist around, you can probably talk to a personal trainer or a kinesiologist who has a good background in helping people with stroke about how to best start exercising again. Question 67. How helpful are treatments like yoga, acupuncture, and massage? Dr. Carmichael. Yoga can have a positive role in recovery. It's a way to be physically active and use the postures to stretch and enhance flexibility. It doesn't replace structured use of the impaired function, but I encourage patients to get out and be physical. So if yoga is their thing, that's great. Acupuncture has a role for chronic pain. However, even in well-established acupuncture clinics, only about 30% of patients will experience the pain relief benefit. It has less of a role with strokes since there's no evidence that acupuncture works to promote brain plasticity or recovery in stroke, and it can be expensive. Massage is a passive treatment. The patient isn't actively engaging in the recovery process, but it can have benefits in terms of reducing anxiety and pain. However, if it takes away from the time the patient has to devote to being active and pursuing active recovery, then it's not good. Question 68. What about hyperbaric oxygen treatment? Dr. Carmichael. Hyperbaric oxygen therapy is a treatment that hyperoxygenates the blood by putting a person in a pressurized chamber. Hyperbaric oxygen therapy is approved for only a few things in the United States, including diabetic ulcers on the legs and the BENS, which is nitrogen damage from rapidly surfacing when deep water diving, but it has not been approved for stroke. In the early stages of stroke, a clot is blocking a blood vessel. However, after the first 3 days, the blood is flowing normally again, so there isn't a problem of low oxygen in the brain. The idea that putting somebody in a hyperbaric oxygen chamber will enhance recovery is just not scientifically supported. The person doesn't have an oxygen deficit anymore. The problem is that everybody feels a little boost when the blood is hyperoxygenated, so there's a strong placebo effect, but it isn't sustained. There is no actual mechanism of enhanced repair in the brain or enhanced recovery. Unfortunately, there are a lot of stroke survivors suffering without proven treatments, so there is a big market for alternative treatments. Entrepreneurs are more than happy to provide hope and charge you quite a bit to go into their expensive machine without any guarantee of results. Question 69. How does sleep impact recovery, and how important is sleep for somebody who has had a stroke? Dr. Roth. So much of stroke recovery emphasizes the importance of the individual's energy and effort, both of which require the person to be well rested. The stroke survivor has to have had sufficient sleep to be able to put the effort into recovery. Exhaustion is a common problem, and rehabilitation, if it's done right, can be very tiring. Sometimes people may actually have a somewhat easier time sleeping because they're working so hard during the day. Unfortunately, there are many people who don't do a whole lot following their stroke, and many of them will have difficulty sleeping. Some people will take naps during the day, which interferes with sleeping at night more than most people realize. And some people have bad sleep habits, for example, drinking too much caffeine, watching TV, or doing something that's too stimulating before bedtime. They need to change these habits or behaviors to improve their sleep. Doctors can also prescribe certain medications to help with sleep. I try to use natural medications whenever possible because they have fewer side effects. We can use melatonin if someone is having trouble sleeping. It's sold in health food stores and pharmacies, and it's a natural hormone that exists in the body and helps many people sleep. Question 70. What can stroke survivors do if they feel fatigued all the time? Dr. Roth. Fatigue, or neurofatigue, is a very common problem, and it's one that's receiving a tremendous amount of scientific investigation right now. It's very hard to measure fatigue or to conduct research studies on it because it's so subjective. Quite honestly, the full cause of neurofatigue is not fully understood. I suspect it's partly that the brain is being asked to do a lot of things, but with part of the brain being injured, it doesn't have quite as much to work with. So the brain tissue that's remaining has to work that much harder, and it becomes exhausting. It's similar to what happens to the muscles in the body that start to compensate for the weaker muscles. They get overused. There are other theories on why it happens, like metabolic or endocrine changes, changes in hormone levels. It's a very important problem because of how pervasive and persistent it is in stroke and brain injury survivors. I have patients who have recovered fully or almost fully from their strokes and say their main remaining symptom is fatigue. There aren't simple answers. Typically, I will say, the best thing to do is balance rest and exercise. Because they're fatigued, some people will just rest and spend their day being vegetative, watching TV, sitting in a chair all day, taking a lot of naps, not doing much. That is the wrong approach. Having said that, I absolutely believe that working too hard will make the fatigue and other symptoms worse. In fact, there are two sets of symptoms that people have. One is that they feel pooped more frequently and earlier, and the other is that their performance gets worse when they get fatigued. So not only do they get tired out, but also when they're tired, they tend to walk a bit worse. Their balance isn't as good, they're at greater risk for falls, they may talk with more slurred speech, and their arms may be weaker. Physical changes happen because they're fatigued. What I adamantly tell people is, we want you to work hard to the point of fatigue, but not through fatigue. The same with working to pain, but not through pain. They have to be the judge of it because nobody else can know when they're at that point. I don't say to them, work this number of hours or walk that distance. I say, work as much as you can or walk as far as you can, but stop before you get fatigued. Don't push through it, which is different from a lot of what we tell them in other things that we do, where we're pushing people beyond what they think is their limit. Dr. Holland, it's very important for people in rehab to let others know when they are tired, when their energy is really low. It doesn't do any good for the quality of your rehabilitative experience if you try to do your therapy when you are very tired. Make sure that the staff understands the level of your energy and tries to work within it. That's an important concept throughout recovery. People with a variety of neurological problems tend to be fatigued and easily drained, and the therapists don't always remember that.
I get tired a lot. My brain needs rest. They call this neurofatigue, and most of the stroke survivors I know have it. We need more sleep, and we tire easily when we use our brains. Before, I tired out easily when I used my muscles. But now, at times, it is tiring to use my brain too much as well. Make sure you are getting good sleep. Rest when you need it. But also make sure you're working hard for your recovery. This includes staying active, staying connected, and exercising. As they say, use it or lose it. David.
A tip. Whole person-centered treatment is essential in recovery. Your physical health, psychological well-being, social life, and spirituality are all elements that must be addressed. Here's one example of how these aspects interact. Medication can affect sleep, and sleep can affect energy levels. Having higher levels of energy makes you more likely to connect with friends or work harder in therapy. Your beliefs or spiritual practice, through prayer, meditation, or nature, can help you find serenity in your journey. Make sure you aren't neglecting any of these needs because each one is a piece of your healing process. Dr. Chu, if you're feeling tired all the time, first you'll want to make sure there isn't a medical condition aside from the stroke that's leading to the fatigue, like an infection or anemia, which is low count of red blood cells. Once you rule out other causes, ask why the stroke is leading to this feeling of being tired and fatigued. Part of it could be that it just takes greater effort for you to do things that you used to do without much effort. If you have trouble walking, getting from point A to point B now may take 10 times as long and 10 times as much effort. Also, about a third of people have mood disorders after a stroke. They have conditions like depression that can cause a feeling of being tired or fatigued. There is also something called obstructive sleep apnea, a condition where you have pauses in your breathing during sleep. The hallmark of obstructive sleep apnea is being tired because you're not getting good oxygenation at night. You may be observed to snore, and you don't feel refreshed after a night's sleep because you're not getting enough oxygen to the brain. Sleep apnea can be both a cause and a result of stroke. The good news is that sleep apnea is a readily diagnosable and treatable condition, so it's worthwhile to get a screening for it if you have excessive daytime sleepiness after a stroke. Question 71. Is it safe for a stroke survivor to be sexually active again? Are there other issues for intimacy after a stroke that people should consider? Dr. Chu. Physical activity after a stroke is highly encouraged, particularly moderate aerobic physical activity, and I put sexual activity in that category. The last thing you want to do is become sedentary, become a couch potato. There are other issues that can affect intimacy after a stroke. Mood problems, which are unfortunately quite prevalent, can affect feelings of intimacy and sometimes have an effect on performance or confidence. But in terms of the safety, for those who have the desire, it's to be highly encouraged. Dr. Gillen, many times sexual function is not discussed after a stroke. It might be because the therapist isn't comfortable with the topic, or because he or she makes an incorrect assumption that older adults don't have a sex life. That should never be the case. Sexual relations have to be considered as part of a partnership and as an activity of daily living. Many times the sexual relationship stops because the partner is afraid of hurting the stroke survivor, or they might both think it could cause another stroke, which is unfounded. Also, positions that were preferred before might be difficult or impossible to assume after a stroke. Therapists can help you work through these issues in terms of choosing activities that partners can do together to have a relationship and that fulfill intimacy needs. The problem is that when we go from partner to caregiver, that's a whole switch in relationship dynamics. Sex and intimacy are part of our lives, and couples need to find a balance between caregiving and having a relationship.
A stroke survivor asks, can I still have children after a stroke?
Dr. Roth. Yes, a woman can still have children after a stroke. There is no impact of the stroke on fertility, on the ability to carry a baby, or on pregnancy, labor, or delivery. It may be a little more uncomfortable and difficult to carry the baby because the mechanics of movement change so much when the uterus is enlarged. And sometimes the person may have a very difficult time finding a comfortable position, but it's not a complication. I've seen many women who've had babies after having a stroke and they do fine. Talk to your doctor about your personal risk factors. Takeaway points. Improving your diet, exercise, and sleep are the most important things you can do for your health after a stroke. A low-sodium, low-carbohydrate diet that is also low in saturated fats is the healthiest. The Mediterranean diet, one high in fish, beans, fruits, vegetables, whole grains, lean meats, and olive oil, may be best. There is no evidence to support the claim that taking any natural or vitamin supplements helps improve brain health. The exception to this is B-complex vitamins, including folic acid. Talk to your doctor before starting any new supplement as it may interact with your medications. It's important to exercise after a stroke. Before returning to the gym to exercise, talk to your doctor to make sure that your risk factors are under control. If you have mobility problems, enlist the help of a physical therapist or other exercise specialist. Getting good sleep is very important. Don't eat or drink caffeine too close to bedtime. Don't take naps if you have trouble sleeping at night. And stop taking part in stimulating activities and watching screens late at night. If you're having trouble sleeping, try melatonin before choosing regular sleeping pills. Fatigue is one of the most bothersome and long-lasting problems for stroke survivors. Try to balance your rest and effort, and don't push through the fatigue. Talk to your doctor about your fatigue, as there may be a treatable cause that is unrelated to your stroke. Sexuality after a stroke is not something that should be ignored. Ask for advice on when it's safe to resume sexual activity and ways to modify your activities. The emotional and relationship components of sexuality are likely to be far more complicated than the physical aspects.